Hi, my name is Amy Kossik. I am an infection preventionist at Reading Hospital in Pennsylvania. We are about a 900 bed facility. We're a level 1 trauma center. So we have a wide range of things that we do in the hospital. There's lots of stuff to see on a daily basis, lots of interesting things going on. As an infection preventionist, it's my job to help make sure that all of the patients, staff, and visitors to the hospital stay healthy while they're here. So we do whatever we can to prevent infection. We follow the latest guidelines and evidence-based practice so that we can keep our patients as safe as possible. So global health, what my perception of global health is, I think this is the perfect time to be talking about global health with the coronavirus outbreak that's going on. I think that's a really good example to use, that we can do whatever we can in the United States to keep the people of the United States healthy, but other people in other parts of the world not being as healthy does still affect us. So global health is utilizing the knowledge and the resources that we have to help promote healthy communities in other parts of the world as well, because we are only going to be as healthy as the sickest people in the world, because those diseases are still going to make their way around. I think tuberculosis is a really good example. We don't see very many cases of tuberculosis in the United States, but the cases that we do see are typically people that got tuberculosis in other parts of the world and then came back here with tuberculosis. So if tuberculosis is something we can eradicate from other parts of the world, then we can completely eradicate it and make sure that it is no longer a threat. The priority of global health, I think, is making sure that everybody in the world has access to clean water, sanitation, and healthcare in some form, so that they can wash their hands, they can drink clean water and not get diseases from the water. They can use the bathroom and it won't run the risk of infecting water sources in the area. And if they are sick, that they have access to healthcare and people that can help them get better. I think it's a lofty goal to be able to provide this for everybody, but I do think that those are our biggest priorities. I think that global health affects me in my job, my current job, immensely. And I'd like to go back to coronavirus for that one, because there is a lot of work that I've been doing lately with coronavirus, because it's my job to make sure that the staff know what to do if we were to get a coronavirus patient in here, and that we implement all the right measures so that we do not have coronavirus spread within the facility or to any of our employees. So coronavirus is something it's a new disease, and we don't know a whole lot about it. We're kind of learning as we go, but it came from another country. It was spread very, very quickly, and not because the other countries didn't do things to try to prevent the spread. It's just one of those illnesses that is very easily spread, and it can be difficult to contain. But if there were other diseases that were to come out of other countries, like coronavirus, maybe diseases that are a lot more detrimental to a lot of people's health and can cause a lot of death and mortality, it's something that affects me, because it's something that I would have to help the hospital to be able to contain, and it could potentially affect the patients here or the staff here. It just affects my job immensely. I'm hoping for healthcare as an industry to become more knowledgeable about emerging infectious diseases, things that we see on a global scale, so that we can handle them appropriately and with the right resources and the right expectations, and not sensationalize them, which I do feel like we are currently seeing with the coronavirus, and not cause panic. We need to be calm, cool, and collected, and have good outbreak response, because I think that is going to be very important to the healthcare system as a whole. I think that an emerging infectious disease, that maybe one that we don't know about yet, could be very detrimental to our society and our life here. So we need to work on our outbreak response and our emergency preparedness. Well, it's very great to meet all of you. I look forward to working with all of you over the next semester.